holy grail of medicine for every doctor is to prevent a disease rather than treat it. For the first time almost in history, we've got the option of actually stopping diseases before they occur. So if there's a pattern of disease in a family, or if we can diagnose genetic defects that occur within a family, we can stop babies from getting very severe illnesses before they're even properly conceived.
Approximately 1% of all babies born suffer from a genetic condition, and there are about 3,000 of these, and most of these disorders present either in the newborn period or early infancy. Every state offers a newborn screening program, but they only look at a very small number of disorders, for example, cystic fibrosis or phenylketonuria. And the problem with this is that the diagnosis is made after the baby is born, not before you have conceived the pregnancy, where you have different choices. The preconception panel was developed by a number of paediatricians who were looking at a fast way of diagnosing babies who presented in their neonatal intensive care units. In the past, they would think, is it this syndrome? We'll test for that gene. When that came back negative, they'd look at the next most likely syndrome and test that gene. And it could take weeks to make a diagnosis.
Families are often surprised to hear that there's a genetic disease in their child, particularly what's called an autosomal recessive disease, where the child's inherited two defective genes from their parents, and the parents themselves are what we call carriers, so they have one defective gene and one good gene. It doesn't cause any problems for the parents themselves, but what a lot of people are surprised that they're actually carriers for a genetic disease, but everybody, absolutely everybody, including myself, are carriers for at least 5 or 6 different genetic diseases. And the only way you can have a child with these diseases if your partner is a carrier for the same disease process. Now, some genes are very common in our community, and you're more likely to find somebody who's also a carrier. Best example is cystic fibrosis, where 1 in 25 people walking around Australia are carriers for cystic fibrosis. Other genes are rarer, however, that's how genetic diseases come about. So the concept of a preconception screen is to identify whether the prospective couples are carriers for both the same genes. And the aim of that is realistically to give them choices so they can understand what that disease process is, but also their risk for having a child with that disease process. And I guess the role of a clinical geneticist in that scenario is not just to help facilitate testing, but also to explain to the families what the impact of that disease is.
At Virtus Health, we are offering a preconception screening panel that entails only a single blood test. It looks at 590 autosomal recessive genetic disorders in 552 genes. If you and your partner are both positive for changes in one of these genes, you have a 1 in 4 chance of having a child with the disorder. By having this screening prior to pregnancy, you are able then to choose what form of prenatal diagnosis or family planning you would like to follow to conceive a healthy child.